If you take medications, you may be wondering, what does Medicare Part D cover? Medicare Part D was created to provide you with coverage for outpatient medications that you pick up at the pharmacy yourself or order via mail order and administer to yourself. You will get your Part D coverage through a standalone Part D drug plan offered by a private insurance carrier or through a Medicare Advantage plan that includes built-in Part D. Every plan must meet federal minimum coverage guidelines outlined by Medicare. For example, all Part D plans must cover all or substantially all medications in the following classes: antidepressants, anti-cancer meds, antipsychotics, anticonvulsants, immunosuppressants, and HIV/AIDS medications. Part D plans must also cover at least 2 medications in each therapeutic class of drugs, so that if a new health condition arises mid-year, your doctors will have adequate choices of covered medications to consider prescribing to you. Beyond that, each Part D plan can choose which medications to include in its formulary, and the formularies can change from year to year, so you'll want to review every year which drug plan best covers the medications that you take. All Part D drug plans also have 4 stages, and Medicare sets the limits for each of these stages each year. Companies can offer benefits that are richer than the minimum standard, but not less than the standard. The 4 stages of Part D are as follows: deductible, initial coverage, coverage gap or donut hole, and catastrophic coverage. Let's start by talking about the deductible. The deductible is the amount that you pay out of pocket each year toward your medications before your insurance plan kicks in any coverage. Medicare sets the maximum allowable deductible each year, and Part D companies must keep their plan deductible at or below that number. In 2023, the maximum allowable deductible is $505. Here's how that works. Let's say your plan is one that has that standard $505 deductible. You will pay out of pocket completely for your medications until you have spent that much and satisfied the deductible. For example, if you take a medication with a price of $100, you will pay $100 at the pharmacy, and then you will only have $405 left to spend before you fulfill the deductible and move on to the next stage of your drug plan. During the initial coverage level, your Part D plan will cover a portion of the cost of the drug, and you will cover a portion. This is called your copay or coinsurance, and you will pay this at the pharmacy counter when you are picking up your medication. Many plans also offer mail order options if you like that better. Most plans will have 5 or 6 drug tiers, ranging from preferred generics at the lowest end to specialty medications at the highest cost. As you fill these medications, Medicare will tally your total drug spending between you and the insurance company, and if the total drug spending goes over a certain limit each year, the coverage gap or donut hole kicks in. All drug plans have the coverage gap, and once you enter the gap, you will pay up to 25% of the cost of your medications. This means the cost that you were paying before may have been less than what you will pay in the gap. The coverage gap is designed to encourage you to use lower cost drugs whenever possible. When you choose generic drugs, you have a better chance of never reaching the coverage gap or donut hole. The last stage of any Part D drug plan is called catastrophic coverage. Once you reach this stage, you will pay only 5% of the cost of your covered medications or less for the rest of the year. In 2024, some new laws will kick in, and when you reach the catastrophic coverage level, your plan will pay 100% of the cost of your medications until year end. And in 2025, that cap will be lowered to $2,000 so that Medicare beneficiaries will pay a maximum of $2,000 per year toward their covered drug costs. For diabetics, this new legislation also mandates that all insulins must have no more than a $35 copay, even if you are in your deductible or coverage gap. You may also be wondering how Medicare covers things like blood tests, cataract surgeries, and vaccines. So check those out in these next few videos in our What Medicare Covers playlist.